So people want to know, what are the benefits and also what are the potential downsides to having a joint replacement? And like any major procedure in surgery, it comes with a risk. Now, fortunately, 1 million people have knee replacements every year globally. It's one of the most common operations carried out. And I'm sure you or members of your family will know people that have had knee replacement surgery. And it is safe, there's no question about that. But people need to know about the potential risks. And in our country now, in the United Kingdom, we have to give you worst case scenario. So the risks include infection. Now, infection can either be superficial, which is as it sounds, it's not deep down towards the joint replacement. And if that occurs and you're unlucky enough to have a superficial infection, it normally responds very well to just antibiotics. If you get a deep infection, well, that's a serious problem. And the national statistics tell us between 1 and 5% of patients, varying on the different units, and fortunately our rates are very low for infection, but those are the national statistics, will get a deep infection. And that's a big problem, and normally that requires us to take out the first knee replacement, a period of antibiotics, and then put in another knee replacement. So it's a real saga for the patient and also very upsetting for the surgeon. But fortunately, it's uncommon. Another risk that we need to warn you about are blood clots. And this can either occur in your leg, that's a deep vein thrombosis, or they can break and travel up to your lungs. That's much rarer. It's called a pulmonary embolus. And these are serious complications, and obviously we look out for this and we will treat you if you have an issue such as this post-operatively with blood thinning drugs. But fortunately we take precautions now before, during and after the surgery to minimize your risk of a blood clot. So for instance, you'll be given medication to reduce your risk after the surgery. We're going to use compression pumps of some description to improve the blood flow during the surgery on the non-operated leg and afterwards, of course, on the operated leg. And then we're going to get you going as quickly as we can, and we use other devices to minimize your swelling, such as cryotherapy, that's cold and pressure, which is a machine that we'll prescribe for you, and that will reduce your swelling, which will allow you to move quicker, which will reduce your risk of a blood clot. But these can occur, and again, we have to give you worst case scenarios. You can die from a blood clot, but that's incredibly rare, but we have to say that. There's also the risk from the anesthetic. So you can have an adverse reaction to an anesthetic. We call that an anaphylactic response. That is usually very easily treated by the anaesthetist monitoring you at all time, and it's rare. But if it occurs, it will need treating. In very rare situations, people can die from an anesthetic. And again, this is worst case scenario. We have to tell you that because that's the process in the United Kingdom. And it's important you know the worst case scenario for any particular complication. There's a risk of damaging nerves and vessels around the knee during the surgery. Very uncommon. In fact, it's not something I've ever seen in my career, but it can occur. We need to mention it to you. The biggest risk with a knee replacement is stiffness afterwards. Now, normally the physios will unstiffen the joint. Occasionally, we need to do a further procedure to get the knee working better. And sometimes people are left with a stiff knee, a bad result. But again, fortunately, this is uncommon. There's a risk that the prosthesis, the knee replacement, doesn't last forever. Now, in a 65-year-old plus, knee replacements last for 20 years in the vast majority of cases. But recent studies from this country and from other countries, and a very important paper for us is the Baylis paper, showed that if you're 60 or less and you have a knee replacement, there's a much higher chance of failure. And 55 was a critical age. So that's something you really need to be considering. We would only do a total knee replacement in somebody who's under the age of 55 if we had nowhere else to go. The biggest risk that we have with total knee replacement surgery is a bad outcome. So that means that you're unhappy a bit, moderately, or a lot with your total knee replacement. And if you look at the 100,000 total knee replacements being carried out in the United Kingdom, 10% are amazing, 70% are good, and 20 to 30% are not good, a bit, moderately, or a lot. So that is something we need to tell you about. And I'm sure you're thinking, well, presumably you can sort it out if it's a problem, but actually the vast majority, the surgeon felt good about the procedure. There's no untoward event, there's no infection, there's no issue. The patient just has this pain that we can't explain. So it's a really, really big decision when you're thinking about knee replacement surgery, is to understand that there's this risk of doing well, doing brilliantly, or a proportion of patients not doing well.